Master Public Health first-year students here. The second-year students will join us shortly. They were still going through their presentation. We tried to make sure that we have this seminar at the time that suits both cohorts, but hopefully they will join us soon. And I also see some of our graduates of the Master Public Health program. My name is Bartuhi. I'm the Dean of the Turpanjan School of Public Health. We usually try to have very important topics covered in our seminar series that is called Public Health Seminar. And today we have a wonderful occasion to have with us Dr. Myron Alukyan, who was actually contributing to the first conversations of creating the Master of Public Health program at AUA when Dr. Harutun Armenian was tasked with creating a new curriculum and a new program at AUA. So we are very thankful to that. Your name is on our website. We have a story on the history of creation of our program. And about 9 years ago, Dr. Alukyan was here presenting about the US healthcare system. But today, his topic is much broader, 21st century public health challenges and your role and responsibility. Very appropriate topic for this audience. But before I say a few more words about Dr. Alukyan, I would like to thank Karagozyan Foundation because his trip was possible thanks to Karagozyan Foundation, and if I'm not mistaken, Dr. Alukyan is in the board of trustees of Karagozyan Foundation. I see some of our dentist graduates. Good to see you because Karagozyan Foundation is focusing on dental care and preventive dentistry. Hopefully soon you will hear some announcement about the Karagozyan Foundation. Okay, so a few words about Dr. Alukyan and his very distinguished career in public health. He is an internationally recognized public health expert and a past president of the American Public Health Association. He was the City of Boston Dental Director for 34 years and served as chairman of the U.S. Surgeon General's Work Group on Fluoridation and Dental Health for the 1990 Prevention Objectives for the Nation and the Dental Advisory Committee for Healthy People 2000, 2010, 2020, the National Prevention Objectives. He is on the faculty of the Schools of Dental Medicine of Harvard, Boston University and Tufts, and was elected to the National Academy of Medicine, National Academy of Sciences in 1991. He is also an honorary fellow in the Royal Society of Health of Great Britain. Dr. Alukyan was an associate editor of the Journal of Public Health Dentistry. A trustee of the New England College of Optometry, Dr. Alukyan was also on the board of directors of the Harvard Alumni Association and was the dental clinical director of the New England AIDS Education and Training Center. He has received over 50 awards, including both the Distinguished Faculty and Distinguished Alumni Awards from Harvard, the Alumni Merit Award from the University of Pennsylvania, and Sedgwick Memorial Medal for Distinguished Services to Public Health from the American Public Health Association. Recognition from the American Dental Association, U.S. Department of Labor, and U.S. Public Health Service. He received his bachelor degree in psychology from Tufts College, his dental degree from the University of Pennsylvania, and his Master of Public Health degree from the Harvard School of Public Health. He has also a meritorious postdoctoral fellow at Harvard. Dr. Alukyan is currently the president of the Massachusetts Coalition for Oral Health, vice chair of the Oral Health Working Group, World Federation of Public Health Associations, vice president of the American Fluoridation Society, and former treasurer of the Commission of Dental Competency Assessment. Thank you, Dr. Alukyan. Please.
Thank you for that introduction. When you hear that introduction, you say, gee, this guy must be very bright, very smart. He's done a lot. I'll never achieve that. Just so you know, neither of my parents finished high school. I went to a very good high school by accident, and I ended up going to college only because everyone else at the school I was going to college, and I said, well, if they're going, I should go too. In high school, I was an average student. In college, I was an average student. I got accepted to dental school 2 days before dental school began. In dental school, I was an average student. The message here is you don't have to be the smartest or brightest person in the world to get things done. You have to have a passion to make a difference. You have to have a passion to change and improve people's lives. In the world today, there are about 1 billion people living in extreme poverty. Extreme poverty, which means they don't know where their meal is coming from today. They don't know where they're going to sleep today. They don't know if they're going to be safe when they go to sleep, if they find a place to sleep. 1 billion people in the world. I would expect, is everyone here a college graduate? Okay. 1 out of every 100 people in the world are college graduates. 1 out of 100. You are in that 1%. We have a responsibility to help the family, our family of human beings, have a better life. We are on top. We know we have food today. We know we have a place to sleep. We know we will be safe. 1 billion people do not have that. Who can make that difference? We can make that difference. You can make that difference. And you can make it in different ways. Whether you're in a country like the United States, that is probably one of the richest in the world, but has almost 1.5 million homeless people who live from day to day, even though it's a rich country. And in many countries in the world, you have homeless, you have refugees, you have wars that take place, and you have big business and corporations that their major job is to make money, and they make money by making people sicker. So these are the challenges we face in public health. And this is we who are trying to make that difference with very limited resources. So how can some of us make an impact on the world? And it can be done. You know, someone like Nelson Mandela was one person in South Africa who was in jail for years and years. But when he came out, he made a difference. Martin Luther King Jr., he made a difference, one person. They didn't give up. And I think in terms of making a difference of what I call the 3 Ps: patience, perseverance, and persistence. You don't give up. Someone says, no, you can't do it, you find another way to get it done. We are all born in environments where we have a glass ceiling. We do not think we can go any further than here. When I was a member of the American Public Health Association as a dentist, I never in a million years thought I would become president one day. But in my area, I kept getting things done. I kept coming with ideas. I kept finding ways to make things better for people. I wasn't the smartest person in the room, but I got things done. I didn't give up. And that's how you make a difference. And that's what I hope and would expect, that everyone who's a student in public health has the passion to make a difference. That's what schools of public health are all about. What's the data? What are the needs? What are the needs? What are the resources? What's the plan or the policy? Implement it, enforce it, and evaluate it. That's basic public health. Basic public health. I have a whole bunch of slides I'm going to go through very quickly. I am going to ask you in the audience questions that may come up to see what your thinking is in terms of certain public health issues or problems. I want you to feel free to ask questions. Let's leave the questions to the end, unless you have a point of clarification. If I have something you don't understand, raise your hand and I'll explain. But if you want to give a different perspective or whatever, let's keep that to the very end. Okay? So can we go over the lights in the front, please? Okay, this is the city of Boston. Boston is a community of roughly 600. There are, well, can we, so they can see the, let's kill these in the front too. Just lower them a little bit. Can we kill these lights here? Is that possible?
Can you turn them off?
And you can turn the lights on in the back so people can take notes if they want. Very few people use pencil and paper anymore. I use it all the time. That way I don't lose it. Okay, this is the city of Boston, a community of roughly 600,000 people. 600,000 people live there. During the day, it's up to 1.2 million people. In greater Boston, it's roughly 2.5 million people. When I was the dental director for the city of Boston, my patient was the city of Boston. In public health, the community is your patient. And as the dental director for the city of Boston, I did the best I could to improve the oral health of the people who live in the city of Boston. This is the State House. This is where the laws are made for the state of Massachusetts. Massachusetts, in the state legislature, we get some 10,000 bills every 2 years. Of those 10,000 bills, maybe 800 are health-related, and of those, maybe 8 to 12 are dentally related. Now, Massachusetts has more colleges and universities than any other state in the United States. Boston had the first public school in the United States, founded in 1635, Boston Latin School. And it had the first college in the world in 1636. That was Harvard College. We had the first bank, we had the first cemetery, we had the first mutual fund, we had the first Board of Health, we invented the razor, we had the first cemetery in Boston. So there are many firsts for the United States that occurred in Boston. And it's a very walkable city. There's a lot of activity. Does anyone here know, have you heard of the New England Patriots football team? You know, they've won a number of times the national. This is the U.S. Congress in Washington, D.C. This is where the laws are made for the United States. One of the most significant laws passed in the United States was 1965 Medicare, which is health care for people over 65. Medicaid was passed around the same time, which is health care for the low income. That was in 1965 as well. Medicare was a federal program run by the federal government. Medicaid for the low income is federal plus state. So under Medicaid, for individuals 20 and under, there are mandated services by the federal government. For 21 and over, there are certain mandated services and then optional services that the state can provide. I think John F. Kennedy said it best: the health of a nation is the key to its future. And that's why it's so important that we have schools of public health, and that public health graduates get involved and make change and improve the health of their communities. We try to do it for the population as a whole, but we also focus on the most vulnerable, high-risk populations, the medically compromised, the low-income, cultural and linguistic minorities, the elderly, people with HIV, as examples. Can we afford the doctor? This is a problem in many countries throughout the world. Being able to pay for the cost of health care. Some countries have nationalized the health care system. Others have insurance mechanisms. Others have a combination. This is the cover of a magazine in Great Britain before they began the National Health Service Corps in Great Britain, because people could not afford to get health care. They ended up with a nationalized health care system. Can you afford to get sick? This is from a magazine in the United States before we began with Obamacare. But essentially, in the United States, we had a health care system that was out of balance. And medical debt was the major reason that people went bankrupt. couldn't pay their bills, they couldn't pay their medical bills, they'd lose their home to pay for health costs. And that's why Medicare passed at 65, and that was key in terms of Obamacare, or the Affordable Care Act. Now, when you look at health, you need to think of what are the social determinants of health. And when you go to a community that's at risk or having difficulty, and you say, what are your major grievances? What are your major problems? When we had riots in the black community in the United States in the 60s, they did a commission report, the Kerner Commission, and these are the major grievances that they had. When you look at this, you don't see health care. But at that time, the infant mortality rate of blacks was 3 times whites. The maternity mortality rate was 3 times blacks versus whites. But if you've never had health care, if you don't know what health is, you don't ask for it because you think that's the way it should be. And that's why we have an enormous challenge to educate communities and populations about what good health is. That they break through the glass ceiling of the death, disease, and disability that they're living. But if people don't have jobs, and if they don't have housing, and if the police are harassing them, they can't have a decent life. And these often take priorities, and these affect the health status of individuals. And I'm sure here at the School of Public Health you learn about the social determinants of health because they impact your health status and the health status of the community. Let's say we have a city that has a river in the middle of the city. And to get from one part of the city to the other, you have to go through the river. So every day, hundreds of people will cross the river, but because there are currents and because they can't swim, some of them will drown. So the city says, you know, we have people drowning in the river as they try to get from one part of the city to the other. So let's hire lifeguards. So the city hires lifeguards. And every day they save 10, 20, 30 people. And they say, gee, aren't we doing a good job? People aren't dying like they used to because the city began a lifeguard program. The population increases. And there are more and more people crossing the river. So they hire more lifeguards. More expensive to save people. We're getting more efficient, but we're saving more and more people every day. More and more people are drowning. We're saving more and more. Aren't we doing a great job? Time goes on. Population increases. There are new technologies. So the city says, let's use the latest technology. So they get helicopters. They get jet skis. It's costs more now to save people, but we're doing it faster and more efficiently. Aren't we doing a great job? We're very expensive. We're doing a great job. That's many healthcare systems. They're crisis-oriented. They wait until people are drowning. Now, let's get a public health person to help us with all these people who are drowning. So the public health person does an epidemiological study. Why are people drowning? What is epidemiology? You know better than I. The causes and determinants of death, disability. So they do the study and they say, well, the reason people are drowning is because there are currents, people can't swim, and there's no bridge. Let's build a bridge. So they build a bridge. Community-based prevention. We build a bridge. Why are people drowning? People are drowning because they can't swim. So we teach people to swim. So you have community prevention and you have changes in individual behavior. That's what we do in public health. We do epidemiological studies. What's the cause of the disease? Why are people getting HIV? Why are people getting lung cancer? Why are babies dying earlier for some people and not others? Why are some people dying in automobile accidents. They're not wearing seatbelts, they're not following laws. That's what we do in public health. What's the problem? We define it, and then we come to solutions. Now, that's what's great about public health. We can prevent disease. Unfortunately, not many people pay attention to prevention. Now, let's look at the leading causes of death in the United States and Armenia. Heart disease, cancer, unintentional injuries. You know, those are the three major ones. In Armenia, heart disease, stroke, Alzheimer's. The way this was given, they have cancer in a number of categories. I think if you added all the cancers up, it would be a little bit higher. Okay, now, this is for the United States, but it's the number of deaths a year. And as you can see, here's 600,000. 600,000 Americans die a year from heart disease. Almost the same for cancer, and then all of the others much less. So, why are people dying from heart disease? Why are people getting cancer? Where is the money going? How much money do you think the United States spends a year for health care? Someone give me an estimate.
9,000 per capita, approximately.
Very good. And how much does that come to total? $3.5 trillion. The United States spends $3.5 trillion a year for health care. It's almost $10,000 a year. Now, this is the United States here. This is health expenditures, and this is life expectancy. All these countries spend much less than the United States, but have greater life expectancy. So even though the United States spends more money than everyone else, with life expectancy, we're way behind all these other countries. And here we are. All these countries, I don't know if you probably can't read it, but the life expectancy for women in Japan is 85 years. In the United States, it's 80. So the United States is ranked anywhere between 28th to 30th in the world in life expectancy and infant mortality. I think Armenia, the life expectancy is about 70. Is that correct? Does anyone here know? 74? Is that for males and females both?
For males, 71. For
Okay.
females, 78.
Okay, see, women live longer in Armenia. And probably one of the major reasons is they don't smoke. Not as much as men. Men, maybe 50% of the men smoke in Armenia. Now, so we have heart disease, we have cancer. When you look at premature death, what causes premature death the most? It's people's individual behavior. 40% of premature death is individual behavior. Teaching people to swim, teaching people not to smoke, teaching people not to eat junk foods, teaching people to exercise on a regular basis. In the United States, 1 out of every 3 children is either obese or overweight. For adults, it's 2 out of 3. I don't know what it is in Armenia. Does someone here know obesity and overweight, what the numbers are?
15%.
What? I didn't hear you.
15%.
15%?
Children, yeah?
Among children.
15% for children.
15, yeah.
Okay, in the United States, it's 33%. What is it for adults in Armenia?
Second. Every second.
Not sure. How much?
Every second.
I can't hear you.
Every second.
Every second? Okay. Every second someone becomes obese or overweight in Armenia? Is that what you're saying? Does anyone know what's the obesity and overweight in Armenia? No student here? Well, this is something you should know, the students in public health. So when it comes to individual behavior, that's the major variable for premature death. Genetics, 30%. Healthcare, only 10% impact. Only 10% impact. If you have cancer, stage 1, and it's detected early, treatment may cost $10,000. If you get treatment at stage 4, it's 10 times more, $100,000. So one of the things, if you want to do something about cancer, you do screening of high-risk individuals so you can detect it as early as possible. This would be a good public health program for a country to do. Now, you have the leading causes of death. We'll do this for the United States: heart disease, cancer, stroke. And then you look at the actual causes. Tobacco. Over 480,000 deaths a year occur in the United States because of tobacco. Poor diet and physical inactivity. Just a little bit less. Alcohol. Microbial agents, toxic, motor vehicles, firearms. But you can see how personal behavior can make an impact on one's health. And that's the challenge. How do you get people in Armenia to cut down on smoking? We'll get more into that. You've got some great laws about tobacco, but they're not being enforced. If you have laws and policies and they're not enforced, it doesn't mean anything. You've got to educate the population. You've got to get restaurants. You know, we went to a restaurant, very nice restaurant. I won't mention the name. Great meal. We sit down, and 2 women next to us start smoking. My daughter said, "Don't say anything." And I was dying to say something. So I ended up talking to her. I said, "Don't you have a no smoking section?" He said, "Well, it's very small." And every restaurant I went to, I'd say, "Do you have a no smoking section?" So if everyone says that, if every tourist says that, you're going to get larger and larger no smoking sections. And if you educate the population about secondhand smoke, you know, you have a woman who's pregnant, she doesn't smoke, but her husband does. That fetus is getting secondhand smoke from the mother. And when she's breastfeeding that child and the father, it's a smoke-filled room, or he leaves the room to smoke outside, you can smell the smoke. That secondhand smoke is everywhere. No parent wants their child to be born with defects or problems because of their behavior. But if they don't know that's a problem, they'll do it. And that's part of educating the public. That's part of educating the public. And the ideal way to do it is through your school system. I don't know if does Armenia have a health education program in the schools? Do they talk about tobacco? Okay. Some people say no, you're saying yes.
For adults.
But I'm talking about in the school system.
Yes.
Do they get health education? Okay. Well, I think it's very important they get that, and it covers the major behaviors that can impact their health. There's nothing that is more impressive for an adult, for a 10-year-old girl to say to her father, "Daddy, would you stop smoking so I don't get lung disease?" That makes an impact. Someone has to teach that to their child. Not easy to do, but that's how you make change. Okay, now one other way to look at premature death is years of life, potential years of life lost. And when you look at potential years of life lost, cancer, 19%, unintentional injuries, 18%. What we mean by that is if I'm in an auto accident and I die at the age of 20, and my life expectancy is 80, that means 60 years of potential life I've lost. Whereas if I'm 79 and I have a heart attack, I lose 1 year. So as a society, you need to look at potential years of life lost in addition to the major causes to see how it impacts the productivity of society and the economy and the family. Now, we do have new epidemics that occur. In the United States, we recently began an opioid epidemic. Opioid overdoses. Why did it happen? 2 years ago, I was at a meeting at the National Academy of Sciences. They had the head of the U.S. Health and Human Services, the head of the Food and Drug Administration, the governor of an innovative state, and we talk, what are the problems? What caused the opioid crisis? We're losing 70,000 Americans a year from overdose of opioid. What caused that? Well, how did it get there? Well, this was when it began. Right about here, the number of opioid deaths just started going up. So what happened about this time? Well, from 1999 to 2017, over 700,000 people have died. 2017, over 70,000. It's 130 Americans a year. We had a pharmaceutical company that was promoting to physicians the use of opioids. Why are they doing this? They want to make money. They want to make money for their stockholders. And these are the new challenges. These challenges have been around for years, but we're getting to understand them better. When we did the tobacco settlements, that took 30 or 40 years to get the American people and to get the courts to finally win against big tobacco. Because big tobacco for years had studies that showed tobacco did not cause cancer, even though credible investigators did. Some people say, well, it really doesn't. They made billions of dollars on tobacco. They killed their best customer, so they had to get new customers with their product. And that's what happened with the opioid crisis. In the state of Ohio, this was just last month, there were 2,000 complaints relative to opioid overdoses, and they were asking the court, but all of these complaints came together. And they were asking for a settlement of $504 billion. These are people who died, and the families are suing the company. And the company offered $10 to $12 billion. Because this company went around saying, opioids are good for dealing with pain, there are no problems, blah, blah, blah. And they marketed to the physicians. And if you have a physician who's giving 100,000 doses a year, they just keep selling them. They're making money. They don't care. No regulation, no control. That's a physician. The physician's controlled by the state licensing board. No one knows he's doing it until enough people die. They say, why are people dying? Why are so many people dying in this state, in this community? Oh, this physician is giving out prescriptions. He's making money, the company's making money. They send him on trips around the world, they give him gifts. A bad physician, it happens. And this is one of the challenges you have that's going to be occurring, one of the new challenges. Companies look for different ways to make money with products that may be deleterious to the people who use them, like tobacco. What some of the U.S. companies do, because of the laws and regulations, they can't sell them in the United States, so they sell them in countries where there are no laws and regulations. And this is something that you need to be careful of in Armenia and many countries around the world that don't have the strict laws and regulations that we have in the United States. If it's good enough for the American people, it's good enough for everyone else. But the companies go where they can make the money. They go where they can make the money. And that's one of the challenges. It's not easy to fight these big companies. This took 2,000 people. The descendants of the families of 2,000 people coming together to have enough money to pay the lawyers to fight the lawyers of this big company. Real challenge. And it's up to you to collect the data to show what the problems are. This just occurred last month. Now, one other epidemic I want to talk about is oral diseases. People don't think of it as a problem. And let me show you why it is. One reason is, like in the United States, when you look to 16 to 19-year-olds, 67% have had tooth decay, with almost 6 affected teeth. When you look at 50 to 60-year-olds, 95% have had tooth decay. 53 tooth surfaces in the mouth. Now, a couple of years ago, I was at a symposium in Great Britain. I was the only dentist there with physicians from the US and physicians from Great Britain. And they were comparing the US and the British healthcare system. At the last day, I was one of the speakers. We're all up on the stage, And the chair of the symposium, who was the chief of anesthesiology at Guy's Hospital, a famous hospital, he said the major problem with the US healthcare, with the British healthcare system, is that if I need an artificial kidney, I have to wait 2 years to get an artificial kidney. But if I need to see a dentist, I can get an appointment in 1 week. He said the priorities are backwards. And all the physicians, 2,000 physicians, are always shaking their head. So I said, excuse me, I said, let me look at it from a public health perspective. From a public health perspective, almost everyone in Great Britain needs dental care. So for every person who needs an artificial kidney, there are 5,000 people who need dental care. And that's how you have to set your priorities. And that's the message that you need to get across to the community, to the government, to the policymakers, the public health, the population approach to dealing with disease. The population approach to dealing with disease. Now, I had mentioned earlier that the U.S. is spending about $10,000 a year for health care. Don't say anything, because you know too much. How much do you think the U.S. spends? What percentage of health expenditures do you think the U.S. spends on prevention? 5%?
25.
25%? 55%? Give me a number.
35.
I can't hear you. Say something.
35.
35? Okay. 2 to 3%. 2 to 3%. That's why we have so many problems in the United States. Because we're treating people who are drowning, we're not preventing the disease. And that's why prevention is so important for society. And the people who can promote prevention the best are you folks. Students and graduates of public health schools who get that information to the policymakers, to the leaders of society, the leaders in the community, so they understand the benefits of prevention. So they understand the benefits of prevention. So, because everyone wants to see a healthy population. Everyone wants to see a healthy community. But if people die getting heart attacks every day, you got to deal with that heart attack. But you also have to find a way to prevent people from having heart attacks. Now, when I showed you the amount of disease in the United States, when you look at the different demographics, you can see that if you're black, you have more untreated tooth decay. Low income, 32% versus 11%. And these disparities occur in every society. In every society, where you have minorities, where you have less education, where you have less income, those people are usually at higher risk, no matter what the disease. And these are some of the social determinants of health. In the United States, we have some zip codes where the life expectancy is 10 years less than other zip codes because of the environmental factors, the culture of the community that they're living in. And these are the social determinants that we need to be sensitive to as we're trying to make an impact on a community. Now, what are the dental needs in Armenia? Dr. Robert Begramian, I got these numbers from him, but in Armenia, roughly 95% of children surveyed have tooth decay, with an average of 6 cavities. 95%. 25% had bleeding gums. 13% had pain and infection in need of services. How can a child study if they've got a throbbing toothache? How are they going to eat? How are they going to behave with their siblings? Totally unnecessary for this to occur. Not easy to deal with, but if you haven't measured it, it doesn't exist. You have to measure it and get that information out to policymakers and decision makers. The This is what we'd like to see in every child. This is a 4-year-old child, a nice smile. This is what happens when they have tooth decay. Why should a child at this age have teeth broken down at the gum line? Because they had cavities and no one did anything to help them. This is what we like to see in every adult, a nice smile. A nice smile helps you in many ways. To have good oral health for eating, digestion, speaking, employability, status in society. 19-year-old girl. Would you go to a physician, a dentist who had a smile like that? Would you hire someone who had a smile like that? Would you marry someone who had a smile like that? Oral health can impact your status in society and whether or not you get a job. And that's why it's important, especially considering so many people have the disease. And that's why it needs to be a much higher priority. This is the last tooth in this person's mouth. He came to me at one of our clinics and he said, "Doc, can you save it?" Last tooth in his mouth, but it was important to him because it was part of his body. So we were able to convince him to have it removed. We cut dentures for him. He looked 30 years younger. He was able to eat again, smile, and get a job. But up till then, he was in tough shape. There are a variety of different dental diseases. I won't bother going through all of them, but in addition to gum disease and crooked teeth and complete tooth loss, I'd be interested to know what percentage of adults in Armenia over 65 have no teeth at all. It would be an interesting statistic to have, and then compare that to other countries. Because if you say to the head of a country, 50% of adults in Armenia have no teeth at all, compared to 12% in the United States and 14% in Europe, etc., etc. When the policymakers see that their country is much worse off than everyone else, that doesn't make them look good, it doesn't make the country look good, and that's when you make change. You are the change agents for society. You are the change agents to make things better for populations. So these are a whole bunch of reasons why we want good oral health, which I've already discussed. These are the Karagosian dental clinics. There are 5 of them. Thank you, Alyssa, for this slide. And they have roughly 80,000, 90,000 patient visits a year. It's a free program for children. Essentially, children 12 and under in any of these communities can go to a Karagosian dental clinic and get free dental care. And one of the reasons I'm here is to help them begin a community-oriented prevention program. Because it's one thing to treat people who come in. It's another to go out into the community and treat people in the community. To me, the ideal thing, you want to make an impact on oral disease in Armenia, you fluoridate the water supplies. Community water fluoridation, everyone benefits. No one has to do anything as on the terms of personal behavior. They automatically get the benefit. It's the ideal preventive measure. But you need to make it a priority, and society needs to make it a priority. And given all the needs of a community or a country, where does that fit with everything else? You need to think outside the box. You need to think outside the box. You need to develop a plan. What are the needs? What are the resources? How do you match the needs and the resources and have a plan or a policy? And then you implement that plan and policy, you see what impact it makes, and you develop. These are the core functions of public health. In 1989, the Institute of Medicine came out with the Future of Public Health Report, and they mentioned 3 core functions: needs assessment, policy, and evaluation. And prevention is the name of the game. The more we can prevent, the better off society is. We detect cancer, stage 1, 10,000. Stage 4, 100,000. Huge difference in a country's resources. Now, you can have a policy, and it could be a law, it could be a standard, it could be a regulation, but it makes a difference. I would expect, is there a policy of AUA, no smoking in the building? Is there a policy, no smoking in these buildings?
Yes,
Okay.
in educational building, it's banned.
Okay. Well, every federal building, every public building should have no smoking. Every restaurant should have as a policy. Now, if you have a policy and you don't enforce it, then you have a problem. For example, I started the tobacco control program in Boston, 600,000 people. We had a policy that you can't sell cigarettes to children under the age of 18. How did we enforce it? We got children who were 16 years old. We sent them into a store to buy tobacco. If they owner sold them, we would have an adult and they would get a citation, $100 penalty. And if the same company, the same store did that over and over, the penalties went up, then they'd lose their license to sell tobacco. That's enforcement. In the beginning, for years, we had seatbelt laws in the United States. People still, no one was paying attention to them. When the police started giving you tickets for not wearing a seatbelt, then people started wearing seatbelts. So you need enforcement. So you've got, I think, some very good laws on tobacco in Armenia, but they need to be enforced. They need to be enforced. Massachusetts was the first state in the country to have a state health insurance program that now covers about almost 99% of the population in Massachusetts is covered by health insurance. I don't know if any of you know, this is Senator Kennedy, and this is Governor Romney. He ran for president. But this was in 2006. But people came together with a policy to make a difference in people's lives. Where did they get the data from? They got it from public health folks, epidemiologists, people who collected the data that they could establish a policy. And what is the cost of that? That's where public health people make a difference. We provide them with the information that policymakers can come up with a policy to help the population. This is the public health policy pipeline. Vital statistics. Scientific consensus. You want a strong scientific foundation for whatever the policy is. Then you translate the science into policy. You know, political interest. This is where you run into trouble. Starting in 1970, every year, we, the public health folks in Massachusetts, had bills in the state legislature to do a better job controlling tobacco. We could never get anything. We'd have 30 people testifying at the hearing. The tobacco company would have one person. Every bill we submitted got killed. Do you know why? Money. The tobacco industry paid off all the legislators. So we lost year after year after year. So then in the 1990s, we were educating the public about the dangers of smoking for years. We did a statewide referendum. The public voted. The public voted. Not the legislators, the public. We passed that statewide referendum. California was first. Massachusetts was second. And we passed a referendum to raise the tax on cigarettes because we had data that showed the higher the tax, the less people smoked. We had the data. Where'd that data come from? Public health people. That's where the data comes from. So that passed. Now when it passed in California, one of my public health colleagues was head of the cancer control for the state of California. He's from India. His name is Dilip Bhatt. He called me because I had spoken at their statewide meeting a couple of times to get them support for their public vote. Myron, yes. Dilip, hi. Guess what? What? $600 million. $600 million. When they raised their tobacco tax, they earmarked a certain percentage for tobacco control, $600 million to fight tobacco control in California because they got the public to support it. And California had one of the best, most innovative and creative tobacco control programs in the country. Massachusetts was next. One of my students, Greg Conley, led that fight. He had me chair their first tobacco control planning thing. We won in Massachusetts, I don't remember the number, maybe $250 million. And we used what we learned in California from public health people, and we came up with things that are oriented to the Massachusetts culture, because Massachusetts is very different from California. And we had very creative ways of educating teenagers, educating parents, educating decision makers, educating schools. We got rid of vending machines in communities. We had action groups. Every mechanism we could use to make change we used. And we did very creative advertising. And Massachusetts became the first state in the country to reduce teenage smoking. We beat California because we had all of these things. Now, Massachusetts is much smaller. We have 6 million people. California had maybe 38 million people. But we made an impact. Public health people making a difference. And then once you have your policy, you always, ideally, you have to implement it, and you want to evaluate. You always want to evaluate whatever you do. Again, biostatistics, epidemiology. That's where public health people are so important. And thanks to good data, we passed Obamacare in 2010. Great step forward for the United States. Huge change in policy. And people against it came up with all kinds of reasons what was wrong with the Affordable Care Act and Obamacare. And we had 10 essential services, and one of them was preventive services and wellness. With the 10 essential services, for the first time, if you had a pre-existing condition, if there was something wrong with you, you couldn't be denied health insurance in the United States. That's what this law did. Now, as I look around the room, I can see a lot of people here who have pre-existing conditions. I'd say 2/3 of this room has pre-existing conditions in the United States before the Affordable Care Act. Your insurance premium would be higher. What's that pre-existing condition? Yeah. Diabetic, okay. Hypertension, pre-existing condition. Pre-existing condition.
I'm not a doctor.
Okay. What?
Wait.
Wait. Someone else. Your hand is up? Doesn't matter. Give me a pre-existing condition. What do 2/3 of the people in this room have, pre-existing condition? Take a guess. What? Okay. Stress? The pre-existing condition is being a female. Being a female. In the United States, before Obamacare, if you were a female, your health insurance premium was higher. Obamacare eliminated that. Why would someone do that? To make money. Any way a company can find to make money, more money, they did it. That's what Obamacare did. And the other thing which I mentioned, they had free preventive services for women. There are certain preventive services that women got free. Again, they were focusing, there was a much greater focus on prevention through the Affordable Care Act. So that was great. We had the Affordable Care Act. Then what happens? We get a new president. Now, this happens in lots of countries. A number of years ago, one of your Minister of Health from Armenia came to the United States, and he got 12 of the top experts in healthcare who are Armenian in a room together. I was the only dentist. And we looked at all the problems in Armenia. His name was Miran Nazaretian, you know. He went to all the health problems in Armenia, and what is the most cost-effective way to deal with them? What do you think he came up with is the number one problem, the simplest way to prevent it? Take a guess. Take a guess. What do you think? What disease do you think he picked? Take a guess. You're in public health school? Doesn't matter. Take a guess anyway. Say something. Help them out. Tobacco? Okay. What would be the simplest, what did come up, a disease that affects almost everyone in a simple way to prevent it? Stacey? Cavities? That's right. Tooth decay. I'm the only dentist, all physicians, and when we looked at all the problems, dental tooth decay. And how do we deal with water fluoridation? You put it in the water, everyone benefits. Very simple to do. Unfortunately, 6 months later, he was gone. And unfortunately, Obama, you can only do 2 4-year terms. We have a new president, and one of the things he argued about was against Obamacare. And they said lots of misleading things. When the Affordable Care Act was developed, they formed an expert committee to look at what therapies work and what don't work based on the evidence. Evidence-based therapies. And that they would not pay for therapies that were not evidence-based. The opposition called it a death panel. And they scared the American people to say, with the Affordable Care Act, the death penalties, and you're not going to really get care and you're going to die. So you have to deal with a lot of misleading information when you're developing and promoting a policy. And that's why evidence-based is so important. And that's why what you do in the School of Public Health is so important, that we have good data to show what's really going on, what works and what doesn't work. 24 million people were going to lose their coverage based on the new administration. Unfortunately, the Senate did not go along with it. One person blocked Obamacare from being dismantled. That was Senator McCain, John McCain, a Republican. But he supported continuing the Affordable Care Act. Even though his party was against it, he stood out for what was right. He stood out for what was right, not what was easy to do, not to go along, to get along. He stood up, and people gave him a hard time, but he did the right thing for the right reasons. And that's what we are in public health. We do the right thing for the right reasons, no matter the opposition. When I was setting up dental programs in the city of Boston, organized dentistry didn't want me doing it. They thought it would steal patients from the private dentists. They even hired a private investigator to follow me for 6 months to find something they could use against me. They weren't successful. So we ended up with 19 programs, over 100,000 patient visits a year. We went statewide. We now have over 600,000 patient visits in health center dental programs, where dental is part of overall health care in a community health center. And now they support it. They even give money to support these programs. They were wrong, we were right. We had the data, they didn't. They were dealing with emotion, we were dealing with facts. And we were dealing with what helps the people, not what helps your pocketbook. Big difference. Americans are addicted to alcohol, nicotine, sugar, fat, and salt. This happens in many societies today. Am I over time?
We have still 20 minutes.
Oh, 20 minutes, okay. My watch is on Boston time, good. Okay, unfortunately, in many societies, the products that companies and corporations sell are not good for your health. For example, 70% of Americans eat processed foods. Processed foods are high in sugar, salt, and fat. They make foods to last a long time on the shelf in the store so they can sell it and make money. Not healthy to eat, but they make money. So you have to educate your population about healthy foods and healthy drinks. Now, I don't know, does anyone know what percentage of the Armenian population eats processed food? Does anyone know?
Everybody does.
No, but it's not as high as in the US.
Okay. But it's nice to have that kind of information and data so you know where to focus in terms of your health education. The advertising industry, they help promote products that kill people. For example, tobacco. They spend millions and millions of dollars every year for a product that kills people. But the number one country in the world with advertising is the United States, $191 billion a year. The average American sees 300 to 700 messages a day on different products. It's very hard to live in the United States and not want to buy a new car every year because you're seeing 100 advertisements a day on buying a new car. And if you buy a new car, you'll have a great life. You meet handsome men and beautiful women, and you'll be vacationing in the Bahamas or wherever. That's how they sell their products. You smoke cigarettes, you'll look like, who's a hero? Who's a male or female hero? Schwarzenegger? Tony Tata. Want to look like Tony Tata?
Tony Montana.
Okay. But that's what the tobacco companies do, the advertising industry. They get the best experimental psychologists they can to see what is it that appeals to people, especially teenagers. And then they focus their ads and get people to buy. And the other thing they do is what they call product placement. When you watch a television, what's the most popular television show in Armenia? What? I know. What's the most popular television show in Armenia? What? Okay. Is that a detective show, a love story, or anything?
Talk show.
A reality show. Okay. Reality show. I need like in the United States, when they have a detective show, when they have a problem, they go out and have a drink of alcohol. When they win a case, they have alcohol. When someone's getting married, they get alcohol. When someone dies, they have alcohol. That's called product placement. The liquor industry, the alcohol industry pays the TV people to put their product in the show. It's like a form of hidden advertising. And that happens all the time in the United States.
It happens here in Armenia.
And I'm sure it's happening here, and it's going to get worse. Question?
Mr. Alican, I would say that in Armenia, they are mostly promoting aggression via TV series and soap operas because all the day, or for example, one finishes, and even if it is finished, because we can't tell, one soap opera can be continued for 3 years or even 4, and then after that, another soap opera, another TV series, another aggression, killing and being aggressive, like getting people into stress.
Sure.
And that's why when you approach a man, basically a man in Armenia, and for example, you want to tell that he's smoking, you want to tell that don't smoke please, even if you say please, they're like, this is my life, I am going to smoke.
Sure.
And why are you telling me that? And it is all because of Armenian TV series and women and men. They are all the time sitting and watching those TV series and also news, Armenian news. That's only they are only just giving us only negativity, and the negativity is.
Guys, they are learning modern journalism. Okay, it's not an Armenian phenomenon. I mean, watch the news in the US and you'll be shocked.
This happens in many countries. And what these stories try to do is find something unusual or unique. How can I get someone's attention? You know, how difficult or how different is my behavior have to be so people watch what I do? You know? Now, if I came, if they announced that I was going to come here with Cher and who's the other? Kardashian. Yeah. If Kim Kardashian was coming here with me today, this one would be filled. Now, if we could get Kim Kardashian to do a positive message on prevention or share positive, you know, they're celebrities. Why are they celebrities? I don't know. I don't watch them.
She's coming to the Technology World Conference in October.
That's the IT conference? Is that the one? IT, yeah, okay. Okay, it's the food industry. It's a $2 trillion industry. They spend $30 billion a year promoting their products. And they do it in all different ways. The beverage companies, sugary drinks, they spend almost $1 billion a year promoting drinks high in sugar. Candy companies spend $29 billion a year advertising candies. This is the Statue of Liberty in the United States, big sugar. But the sugar industry has influenced the dietary habits of the U.S. And that's why we have so much obesity and overweight in children and in adults in the United States. But it's a form of, it's a corporation making people sick. And because of the way they advertise, people think it's, you want a better lifestyle, you drink a Coke, or you drink a Pepsi. You smoke and you look tough. And women come all, want to take you out or whatever. You know, they use those techniques to get people's attention. Now, in terms of the food industry, 50% of Americans consume a sugary beverage every day. The average child, 4 cans of soda a week. And they did a big promotion through the public schools and in the communities, and they raised the percent of children drinking soda from 37% to 56% by promoting in ads to kids. On children's TV shows, they promote them. On kids' TV shows, people are drinking sodas. On teenage shows, people are drinking sodas and smoking. 90% of people start smoking by the age of 18 in the United States. After 18, they know better. They get to the teenagers. This is how much sugar is in a can of Coke. Almost 12 teaspoons of sugar in a can of Coke. How many of you realize there's this much sugar in the drink? You know, if you show this to parents, I think many of them will not want their children to drink when they see it like this. But that's not how they normally see it. Now, one of the things we did in the United States a couple of years ago, we started taxes on sugar-sweet beverages. In 2016, WHO came out and said that 20% of sugar-sweet beverages of that tax should go to public health and prevention. In the United States, by 2017, we had 8 cities with 9 million people with taxes on sugar-sweet beverages, like we did with tobacco. We raised the tax on tobacco enormously. And when we passed these regulations in these cities, the use of sugar-sweet beverages went down and water consumption went up. And in 2016, for the first time, people are drinking more bottled water than sugar-sweet beverages, for the first time. Because what the industry did was the slide I showed you earlier, from the 70s to the 90s, big advertising campaign, and people said enough is enough. So we started a movement with the sugar-sweet beverage tax, and that's making an impact. Now, again, tobacco, major problem. Tobacco industry spends $10 billion a year, $28 million a day promoting their product in the United States because they're killing their best customer. 480,000 of their customers die every year from lung cancer and heart disease, so they have to get new customers. So they advertise, advertise, and advertise. And they spend a lot of money in Congress also. Okay, this is, I don't know if you can read this, but this says that R.J. Reynolds Management, this is the lobbyist for the tobacco industry that blocked the Armenian genocide bill in the U.S. Congress. A tobacco company for the Turkish government lobbied and paid people in the U.S. Congress not to pass the Armenian genocide bill in the 1990s. So we have evidence. Not only is the tobacco industry killing people with their product, they're also blocking genocide resolution in the U.S. Congress. They're not our best friends. And they use different techniques. If I smoke, I'm going to look like her. If I smoke, I'm going to be tough and look like him. Now, this is a magazine on women and heart disease. The whole magazine was about how women get heart disease, and the major variable was tobacco. This is how sophisticated the tobacco industry is. Most people read the cover. Some people read the back cover. Very few people read the article. So the tobacco industry knows women are going to buy this. They're going to look at the back cover, and they promote their cigarette. You notice Turkish blend. Look at that. Okay? That's how sophisticated they are. Because they know most people aren't going to read what's inside. But everyone looks at the covers. This is how far they go to sell the cigarettes. Now, as a result of all we've done in tobacco with the United States in education, we've gone from 45% of adults in 65 to 16% today. When I leave my office and I go through the back of the building, there's a little alley there, I'll see one or two people smoking. No one wants anyone smoking in the office. No one wants anyone smoking in the building. But we've made smoking a no-no in the United States. That people hide when they smoke, or they're not allowed to smoke in many of our buildings.
What would you say about the vaping disease?
About what?
Vaping disease?
That's coming up. Good question. Did you see my slides already? So we've made an impact, and you can do the same thing in Armenia. I think in Armenia, maybe 50 or 55% of males from 25 to 55 smoke.
Much bigger percentage for the working age male population.
Okay, and for the working, it's even higher. And these are the same people who are dying early. I think the major cause of death of men in that age group is from tobacco. Now, one of our major pharmaceutical drugstores, where they sell toothpaste, candy, they used to sell cigarettes, CVS. It's one of the biggest companies in the country. They stopped selling cigarettes 2 years ago. This is a full-page ad in the Boston newspaper a week ago. They're proud to be tobacco-free. They made millions selling cigarettes per year, but because of public pressure and public information and public demand, they stopped selling cigarettes. How can a store that sells health products also sell cigarettes that make you sick? Let's talk a little bit about vaping. This is the most recent new thing for kids. What is vaping? What happens? It's an electronic cigarette, and what it does is it burns a particular liquid, and you get, as a result of that, you breathe in this vapor, and it's high in nicotine, as well as lots of other products, as you can see here, organic compounds, cancer-causing chemicals, etc. But the way they've promoted it, this is better than smoking cigarettes. It's cool to do that. And what do the numbers look like? You know, and they promote it saying it's safer. But now we're finding it isn't as safe as people think. And it gives you this much nicotine. This is how much nicotine you can get in 65 minutes. It's 10 times more nicotine in vapors than in a cigarette. 35% of high school kids have vaped in the United States. This says 16%, now it's up to 20% use it regularly in the United States. What are the effects? It increases the odds of heart disease, heart problems, cancer, asthma, and it increases the risk. Lots of kids use this and don't, instead of cigarettes, they're going to end up using cigarettes later. We had the first death from vaping a couple of weeks ago. In August 23, CDC had the first death of a teenager from vaping. And since this came out, 3 other kids have died from vaping. Is it 4? Is it 5 now?
Already 5.
Okay.
5 kids have died.
5 have died from vaping, We have, I think, over 250 cases of people severely ill in 25 states from vaping. And again, it's the advertising industry promoting a product so people can make money. The vape people who make the vapors are making money, and the tobacco and the advertising. Okay, let's talk a little bit about misinformation in the internet. The internet is pervasive, it's everywhere. Harvard is calling it misinfodemics. The new epidemic is misinformation. Misinfodemics. Have you heard that term before? No? Okay. Internet usage. Over 90%. Now it's over 90% of adults use it. 98.3%. It's much higher for teenagers. But 18 to 29, it's higher. And 80% of internet users look for health information. But do they know good information from bad? When you look at there are 4.5 billion people in the world using the internet, and here it is by different countries. The highest is Asia. It's most of them, and then you can see the other countries. In Armenia, most recent data I have, 72% use the internet, 33% Facebook. That was in 2018, I would expect it's higher today. Now, how good is the information on internet? When you look at something like fluoridation, the people who are against fluoridation on their network, on their website, they get 140,000 hits a month. They're against fluoridation. CDC, which is the reputable scientific health agency for the US, only gets 40,000 hits a month. So there's more misinformation on something like fluoridation with junk science than there is good information unless you know where to go. You need to know where to go. And that's a concern we have about the use of the internet is poor information. So even though everyone supports fluoridation, who knows the science and the Surgeon General's report, all of these groups, there's more misinformation on the internet. So it comes down to public interest science versus junk science, emotion, and confusion. And this is something you're going to be dealing with more and more as public health professionals. It's all the misinformation that's out there. You can do credible studies, and then someone else is going to say, well, blah, 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 blah. They get attention for some reason. You got to keep pushing credible sources, evidence-based science. And we as public health professionals need to do a much better job educating the decision makers and the policy makers about it. Okay, I talked about before, if you had the whole world and shrunk it down to 100 people, only one would have a college education. You're that 1 in 100. You're that 1 in 100 that can make a difference. You're that 1 in 100 who has the benefits of an education and know where the meal's coming, where you sleep. Question?
I had a question. Like in our medical college, we were taught that fluoridation has more risks than benefits. Like if you have fluorosis in children, you have enamel deformities, bone deformities, and that is why it is not implemented.
What medical school is that?
I was in Yerevan State Medical University. But we were, it is
Yeah, I
written in
agree.
the text.
Also
It
from
is.
there they
Yes.
tell that-
Yeah,
Okay.
so because we cannot
Some-
regulate the water dosage.
Okay, well, they're not looking at credible science.
Okay.
Most fluorosis occurs because children eat toothpaste. Toothpaste is 1,000 parts per million fluoride, and the water supply is 7/10. When we do the studies on fluorosis, most of it is from kids under age 2 eating toothpaste.
But how is it?
And you don't get bone defects from fluoridation at 7/10 of a part per million. It has to be like over 10 to 20 parts per million. And no one fluoridates at that level. In India, naturally, it's over 20 parts per million and they have bone problems. That has not occurred in this. No one in this country has had bone problems with fluoridation. Naturally fluoridated, it used to be at 8 parts per million in some parts of the country naturally.
Yes.
And EPA came out with regulations, and the maximum permissible level naturally fluoridated is 4 parts per million. And at 4 parts per million, you don't get problems with bone or anything like that. The recommended level is 7/10 of a part per million. And all water supplies have fluoride in it. Whether you want fluoride in there or not, it's there naturally. And based on millions of people for years drinking naturally fluoridated water at different levels, we found that at about 1 part per million, you get the benefit and there's no negative health effects of any kind. So all we did was duplicate what nature showed us. There is a lot of misinformation, I agree, and I'm glad you told me about that, because I'm speaking to them, I think tomorrow or the next day, we'll straighten them out. But, you need to know how to interpret credible science. You don't need to know the source, you need to know how to evaluate a study. So you're 1 out of 100. Everyone in this room is 1 out of 100. Collaborate. You can't get things done by yourself. It's very difficult. You've got to collaborate with other groups, organizations, and agencies. It's a balancing act. Sometimes you have to work with people you disagree with, but what's the evidence? What does the evidence show? And you develop your plan, a policy, a program based on the evidence. You keep coming back to what's the evidence, what works. You can only have sustained change if you in this audience work with your colleagues, your community, its leaders, the different agencies and organizations, and responsive to the needs of the community. Before Obamacare was implemented, there was a lot of misinformation about it. People were shaky about it. It passed. When the next president tried to eliminate it, people supported it because they saw it worked. Women didn't have to pay higher insurance premiums. People who had pre-existing conditions could get health insurance. Prevention was higher. People saw the benefits. So the public supports Obamacare now in the Affordable Care Act. And when they do national opinion surveys, it's very high. Now the thing is the image. People would say, I'm against Obamacare, but I support the Affordable Care Act. It's the same thing. And what people did was they put a label with a negative connotation, and the average person didn't know the difference. I've heard people say, I don't want the government involved in touching my Medicare program. Well, Medicare is a government program, but many people don't know that. So one of the things you need to do is when you develop a program, a policy, you've got to educate the people getting the service so they understand what they're getting and why they're getting it. You've got to get the community involved, treetops and grass tops. The more people who get involved supporting a policy or program, the greater the likely it's going to occur. In the United States, we have the national prevention objectives. We try to bring people together with nationally, how can we work together to prevent different diseases? We do that every 10 years. They're now working on the 2030. And does Armenia have anything comparable with national prevention objectives?
Not for the entire country, but they are developing right now something similar.
Okay. So if you can, again, you need good data. Where's that data coming from? You folks. You need data so you can develop your policies and programs and strategies and get people to work together. It's a balancing act. Uh-oh, this is stuck. Okay. Nothing is so contagious as example. How many people in this room have not had a cigarette in the last 30 days? Raise your hands. How many people in this room have not had a cigarette in the last 30 days? Raise your hands. Okay, hands down. Okay, you need to be role models for health. No physician in Armenia or in any country should smoke. No dentist in Armenia or any country should smoke because it causes lung disease. When people were smoking tobacco originally, it was mostly men. And the tobacco industry said, half the US population doesn't smoke. Women don't smoke. Let's say it's glamorous, and let's get some very beautiful women who are very rich, take some pictures of them smoking, and it's the thing to do. So they got American women to start smoking. As American women started smoking and smoking for years now, more women today die from lung cancer than breast cancer. It used to be more women died from breast cancer. Now more women die from smoke cancer in the U.S. because they've been smoking. Now, as a result of what we've done in the last 10 or 15 years, we've reduced the rate. But I could see the same thing happening in Armenia. When I walk down, is it North Avenue? And I see young, attractive women, well-dressed, smoking, and they think they're cool, I say to myself, what an idiot. Doesn't she realize she's making herself sick? She thinks she's cool. I think she looks like a jerk. But you've got to change that image. Because for years, the U.S. said it's glamorous people smoke. Now we say dumb people smoke. You've got to do the same thing in this country. But you've got to start with your physicians, dentists, nurses. Every hospital should be tobacco-free. Is that true?
The law is there, enforcement, it depends on the management of the hospital.
Okay. Every hospital should be tobacco-free. If most of your young people working are dying from lung disease, and they go into a hospital and they see people smoking, doesn't make sense. And that's where you folks come in with getting the data and getting the message out. So you have to be role models for your patients and your community. Every child in the United States, every child in Armenia should have the best health care possible, the best health status possible. This is my oldest child when he was a baby. We gave him a good orientation for health. My wife was a nurse practitioner. None of our kids ever smoked. We didn't let them eat candy as children. You have Halloween here?
It's coming, but it's not.
Okay, in the United States we have Halloween. Kids go around from door to door and people give them candy. We would take that candy at the end of the day, throw it away. It was fun collecting it, we wouldn't let them eat the candy. And these are my 6 children when they were a little older, 3 boys, 3 girls. It's a planned family. And that's a nice thing about being in public health. You know how to plan things. So you can plan families, you can plan programs, you can plan policies. And this is them a little bit older. Now, these kids, they're all teenagers in this picture. The 6 of them had only 3 very, very, very small cavities. The 6 of them. When I was their age, I had 18 as one person. But because of fluoridation, because of fluoride toothpaste, because of controlling diet and nutrition, they have much healthier mouths and much healthier bodies. So that little baby, here's that little baby with his son, my grandson. He's a role model for better health. And that's what all of you need to be for your children and your grandchildren, role models for better health. He's now a pediatric surgeon in Philadelphia, and this kid hasn't had a cavity, nor has his brothers and sisters. So we make a living by what we get, we make a life by what we give. You are very fortunate to be in the position you're in at this school, learning public health. And now, when you finish, it's your turn to give back to society. Thank you very much. Be happy to take questions. Questions? Someone has to ask the first question, then other people will ask. Who's brave enough to ask the first question? Go ahead.
There was one patient of yours who had only 1 teeth. Was he a drug addict?
No. No. In his community, they didn't have, the question is, there was one patient who had only 1 tooth. Was he a drug addict? No, he wasn't. In that community, it was a very poor community. So when they had a dental problem, the teeth would come out. So he ended up with no teeth because he couldn't afford dental care. We set up a dental program in that community. So we were able to get him dentures. We had a means test, a sliding fee schedule. So he could get a pair of dentures at a reasonable cost and get dental care at a reasonable cost. Good question. You had a question?
Yes, thank you for the lecture. I have a simple question. Have you ever smoked?
Good question. Have I ever smoked? I tried it once. When I was 12 or 13 years old, all my friends were smoking. And I said, I wonder why they smoke. So I took a cigarette And I did it in front of a mirror. And I'm saying, why do they like this? It tastes terrible. I look stupid. One cigarette, just a little bit, I never smoked again. But I tried, because everyone else was doing it. But I thought for myself. I didn't do things because everyone else did it. I thought for myself and said, doesn't make sense. It's expensive, it doesn't taste good, and I look stupid. Any other questions?
Thank you, sir. Why Americans don't copy and paste Canadian healthcare system? I mean, the free medical care in Canada. You can copy and paste. Canada is a mild version of the United States.
Okay, good question. Why don't we adopt the Canadian healthcare system? I didn't show you the slide, but one of the problems we have in the United States, in the U.S. Congress, millions and millions of dollars go in from insurance companies, candy companies, tobacco companies, to influence their vote. And the insurance lobby is very strong. When you go to the United States and go any major city, what is the tallest building in those cities? It's usually an insurance company. They make money. Through the health insurance industry, it's estimated that anywhere between 15 to 20% of healthcare costs goes to administration through insurance companies that administer the programs. So they fight tooth and nail the Canadian system. Now we have a couple of people running for president who are talking about Medicare for all. Medicare for all is similar in some ways to the Canadian system, but the likelihood of that happening, I think, is unlikely, because the labor unions, do you know what a labor union is? The workers get together and negotiate with management. The labor unions negotiated certain health benefits for the labor force. If we went to a Canadian system, they would lose that benefit. And they're saying, we don't want to lose what we have and get something we don't know what it's going to be like. So I would expect the labor unions would be against a Canadian system. And you can't jump. We're lucky we have the Affordable Care Act, Obamacare. We're very, very lucky we have that, because the Republicans are still trying to get rid of it. And the current president we have is against it. And I think the major reason he's against it, other than the fact he doesn't understand it, is because the prior president, it was passed under his name. Anything attached to the prior president, he wants to get rid of. Like the climate change agreement we had with countries, like the agreement with Iran on nuclear. Anything related to Obama, he tries to eliminate and bring in his own stuff. He wants that name recognition. Good question.
I would like to ask the last question because we're over time.
Sure.
I have a question like, we are satisfied with the Trump's rule or the
Am I satisfied with what?
Trump's rule, the president?
Am I
Trump's
president.
Am I
Yeah.
happy with it?
Yeah, happy or? I mean, what would you say? What would you
Turn
say?
off the mic.
We have video recording.
Now you tell me. Well, he's not evidence-based. He's not evidence-based, number one. And number two, the Washington Post newspaper, they document every time he says something incorrectly. And they have documented over 10,000 times he said things that are completely incorrect. So he's not a friend of the public's health from what I've seen so far. Because the Affordable Care Act, because it focused on prevention so much and preventing disease, I don't think he's even aware of that. I don't think he's even aware of that. And, we have another election coming up. Let's see what happens.
Thank you.
You're welcome. But the other thing, being in public health, I worked for the city for 34 years, and we've had different mayors, different people in charge, and you've got to learn to work with different administrations and different policymakers. And one of the reasons I survived so long is because I worked with the community. So any programs I set up, I had the leaders in each of those communities saying, this is a great program. And I had them from both political groups, Republicans and Democrats. So if a new mayor came and says, I'm going to save money and eliminate that, the people says, no, we want that program, and he wants the votes. If he doesn't have the votes, he doesn't get elected. So by having a constituency, and that's why I showed that slide, by having the public involved, the community involved support the program, there's less likelihood a new policy person or a new leader would eliminate. Question way in the back.
Okay, it must be the last question because we have to finish the seminar.
Thank you. Please say three basic ways to do well in Armenian healthcare.
Okay, you want me to name 3 basic ways to do well with Armenian healthcare?
Yes, sir.
Okay. Good question. I think one of the things, first of all, I don't like to go to another country and say you should do A, B, C, D. I think every country needs to determine what it should do based on what are the needs of the country and what are the resources in the country, and come up with a plan of policy. That's what this lecture was mostly about. What are the needs? What are the resources? How do we match them? What program or policy do we have? How do we implement and how do we enforce it? So, but one of the things I would recommend is you do national goals for preventing disease. That you get as many people, all the different, you get business, you get the School of Public Health, you get the medical schools, you get the private, you get all together, different representatives that come up. What are the major health problems in Armenia and how can we prevent them? What data is there that shows we can prevent A, B, and C? So if you came up with national prevention goals, say every 5 or 10 years, like let's say you did it for the year 2025. For 2021, 22, 23, there's different objectives you have to reach the goal for 2025. Get people to agree to it, then put the energy and resources into doing it. I think if you came up with a national plan and agenda. Now, my understanding is that the new Prime Minister has developed what he calls mega goals for the year 2050. Good idea. It's a long way off. You know, I have seen, when I was here 9 or 10 years ago, I've seen major changes in Armenia. You know, where I saw dirt streets, I nicely paved streets. I was on the elevator today with an American. I said, where are you from? He said, Stanford University, one of the best universities in our country. I said, what do you do there? He said, I do the travel programs for them. He said, we have a group, we've gone to 6 different countries. And he named Georgia, Azerbaijan, blah, 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 blah. And he said, this is our last stop. I said, what you think of Armenia? He said, this was the best. He said, the people are friendly, the food is great, it's reasonable, it's safe. And one way you develop an economy is get people to come here and spend money, you know, and it's user-friendly. So I would go with the national prevention goals, and then other health areas that need help. Again, it comes down to having the data, and that comes from people who are trained in public health, who know how to collect data. What are the needs? What are the resources? What's the plan? How can we all work together to reach it? I think that's the best way to move ahead. And the other thing is in the Minister of Health's office, you need people trained in public health. In many countries, I've spoken in many countries, and usually the health minister is the private physician of the president, the premier of the country. No idea what public health is. Might be a good clinician, might be a good cardiac surgeon. There's no idea what population health is. And every Minister of Health should have trained people in public health. The Minister of Health's office should have a dentist trained in public health. When I've been meeting with the people in the Karagosian Foundation, and I'm asking them different questions about oral health, no one has the data. You need the data. The data comes from schools of public health, from epidemiologists, people doing the studies, or people who've been trained in public health and go out and get the data. Does that help you? Nancy? The other thing that might be nice to have, but is so small, is maybe something like a Surgeon General who's always there, irrespective of the administration. so they come up with science-based information. But that probably happens through your medical school being a school of public
There
health.
are agencies that help with it.
Yeah. And the nice thing about having goals like 2025, 20, you get both sides of the aisle in your legislature. People who, I don't know what they're called in this country, but you get everyone to agree, Republican, Democrat. So no matter who the new president or prime minister is, people keep working at that same goal. So it doesn't change every time there's a new administration. And that's what we've been able to do with the national goals of the United States, 2010, 2020, 2030. Irrespective of who the president is, everyone keeps working for those prevention goals. Okay, great question.
On this
Okay,
great
thank you all
note,
very much.
thank you very much for motivating our students and graduates to do what they are supposed to do. Thank you.
Nice to be here.